Rich Americans live up to 15 years longer than poor Americans. A study has found. This is first of all, it was published in the British medical journal, The Lancet. And the Lancet studies, according to theguardian.com, quote, looked at how the American health system affects inequality and structural racism and how mass incarceration and the Affordable Care Act, also known as Obamacare, have changed public health. They go on to say, according to the studies, the richest 1% live up to 15 years longer than the poorest 1%. The same gap in life expectancy widened in recent decades, making poverty a powerful indicator for death. More than 1/3 of low-income Americans avoid medical care because of costs. That's compared to 7% in Canada, 1% in the UK, and life expectancy would have grown 51.1% more from 1983 to 2005 had mass incarceration not accelerated in the mid-1980s. And then also, according to theguardian.com, citing in response to this study, they say, quote, at the same time the ACA brought relief to many, the number of Americans without insurance dropped from 48.6 million in 2010 to 28.6 million in 2015. The number of Americans who struggle with medical bills dropped from 41% to 35% in 2014. Very interesting. Thoughts, 5 words or less.
Get rich or die.
Yeah.
Robin Hood, we need you now.
Just be richer.
What the Health? It's actually a documentary. That's a documentary, and it's a good documentary. Watch it. But it's a powerful statement. What the health? I mean, it's sad. I mean, I've not gone to the doctor or not gone to the dentist because I don't want to pay for it. And preventative care helps you stay healthy.
Yeah. I read about this first published in No Shit magazine.
Right.
It's like, of course, rich people are gonna live longer because they have the means and all these things about, like, you know, if you're poorer, you pay a higher percentage of your income.
Yeah, that's crazy.
I mean, but that makes sense because, you know, all these things only cost a certain amount, and if it's not as big a knock to your financial well-being, of course you're gonna go to the doctor. It's so messed up.
It just kind of feels like there's a paywall for healthcare, and some people have the money that they can like afford it, and it's not a luxury. But then there's that, you know, it makes me think of like for like Hulu and Amazon and like Netflix, and you have to weigh like which one when you're poor, like you have to weigh which one do I really want, and then it's like, do I want to like pay for my car? Do I want to do this? Do I want to pay for my rent, my apartment, my mortgage, or healthcare? And a lot of times when people are healthy, it feels like that's one of those things that they don't want to pay for.
When they think they're healthy, you know. Pardon my offbeat thinking here, but I always think about the powers that be, like super rich people and these corporations that are always engaging in these awful things that affect poor people. And I think to myself, do they think they're immortal? Like, why are they, do they think they're gonna live forever? Well, now this explains a lot to me. They're gonna live 10 to 15 years longer than the people that they're oppressing.
And what about their children?
Well, I can hear the spin. It's like, well, at least your shitty poor life is over quicker. Let's look at, and the thing is, like, the rich people, like they're those extra 15 years they're going to be miserable anyway, inventing problems for themselves to complain about.
It's scary too to look at when it broke down. If you look at the study, we'll include a link to look at the comparison to the other countries. And that's what's sad too. And we all heard Bernie Sanders, really talking and advocating that healthcare should be a right and comparing it to the other countries. And the study breaks down those statistics and to really look at like a family, you're a single mom, a family that you have to make the choice to, gosh, do I take my 2 kids or 1 kid or 4 kids to the doctors, but we can't afford it and I'd rather pay our rent. That should not be somebody shouldn't have to feel the need to have that choice.
We all as a family go to the emergency room and just fall on the ground. And like all of us fall on the ground, let's go. But what I will say is I'll take this as an opportunity to plug organizations. That's why we need like a Planned Parenthood. And we need, because people think about Planned Parenthood, the ones that are against it and think, oh, I'm not supporting that abortion clinic. Planned Parenthood found a lump in my breast that I couldn't afford to go to the doctor. I couldn't afford a mammogram at the time. I had just come out of being homeless. Wow. I went to Planned Parenthood. They found the lump. I had surgery. I had it removed. Wow. And my life is going to last longer and my children will have their mother because I had this organization. And I think that people just undermine the value of,
they do.
Even if morally you're against abortions, Planned Parenthood provides health care that we can't afford afford to get
the majority
otherwise.
of their health care is just health care.
Yeah.
You know, it's not, the abortion portion of it is not federally funded.
Yeah.
The small, teeny portion that's abortion funded is dependent on the privatized, you know, how that is established, but has nothing to do with the federal funds. So defunding that has nothing to do with it. But then you're right, it has to do with the cervical screenings, the cancer screenings, that's how, that was my healthcare all through college.
Yeah.
And then even after college, Planned Parenthood. Thank God for Planned Parenthood.
Yeah.
Thank
Preventative
God.
care makes it cheaper in the long run if
Yes.
you have open sources for that. And the paywall, a lot of it is like the vast majority of healthcare in America is provided by employers, which if you ask anyone in the universe, they go, what the fuck are you guys doing?
Yeah.
Like it is, we have for-profit healthcare companies, which like I understand if we're gonna fix things and change stuff, it's gonna be tough because we have this institutional inertia that's just like these companies, especially under the Obama administration with the ACA, was the single biggest growing industry in America. Are these things that now, like if we want to have a single payer system, we're gonna have to shoehorn the hell out of them into that new system. But I mean, it seems like it makes more sense. Like if you go to England and Canada, you just go to the hospital when you're sick.
Yeah,
You would know, you know more about this than anyone.
Yeah, no, I mean, I have a good story, a little anecdote for that. So when I had a really bad sprained ankle when I was in high school from basketball, and
This
I
is
was
when you
gonna
were in Belgium,
right
just in
when I was
case.
in Belgium, and I was gonna have to be in a cast for a time because it was like really out of line, and I was taken to the emergency room with my parents, and I signed like 2 forms. I got amazing care, and they like set everything back up, gave me a cast. We paid nothing. Like we paid literally nothing. You sign a form, and then when I
Just
had
going
my
to the emergency room,
But
it's
you're
like 10
paying
grand.
taxes,
right, and
but-
then the taxes
Right.
are higher. So I understand what I wanted to
Our
point out
taxes
from,
are high too, to some degree.
Right,
You get
and
what you
then
pay for.
Dollar for dollar, all our services cost more, period. So there's an argument saying like if you give it over to the single payer government system, then there's gonna be, you know, all this pork built into it. It's gonna raise prices because there's no oversight. If the government's taking care of it, it's inefficient, whatever.
Yeah.
That said, like other countries that have this system that you think will spiral out of control have cheaper healthcare,
Right.
service for service, dollar for dollar than we have here.
Yeah,
in
and
this
I think
awesome
that
system that
a lot
is
that
flawless.
comes up a lot when I talk to people about, you know, being from overseas. They're like, well, what do you think about healthcare? And I'm like, I don't think that overnight the US should adopt the system that exists in Belgium. I'm not saying that at all. What I'm saying is that we have these entities that we've given an insane amount of power to, being the healthcare industry, and I don't think that that is okay. Like having it totally privatized. I think that moving towards a socialized healthcare system is at least worth exploring, because what the system that we have right now is obviously not working.
It's not working, and it's punishing the poor.
It's punishing the poor. It's disproportionately helping the wealthy and not helping the poor. It's a disservice.
And people go bankrupt over their healthcare bills. That's
Right.
insane.
It's an inelastic demand. Like that's what's frustrating. And people still, like inelastic demand means like, no matter how much it costs, you're gonna buy it
gonna
because you
pay
don't
it.
want to die.
Yeah.
But
Yeah, the prescription
everything,
costs.
but that inelasticity is stretched by people who don't want to pay money, and so they get to the point where they're about to die, and then they have to get taken to the hospital for some giant emergency procedure that ends up costing way more. And even though they try to avoid it, the doctors are like, we have to save this person, and now you've just had an ambulance, which costs thousands, a procedure, which costs thousands. Like, no matter how fancy a hotel could be, one night in the hospital costs way more.
Way more. And prescriptions cost thousands. People
yeah.
can't even afford their own prescription costs. And then you compare the prescription costs to other places like Canada or other places in the world, and it's you can't even compare it.
It's a profitable business, and poor people, like
I know.
Look, poor people. Look, just think about it. All these organizations or these corporations together, they're contaminating our waters, they're contaminating our environment, and then they're over medicating us, and then they don't want to help us when we get sick. But they're
That's
the ones
what
causing.
the health is about.
Yeah.
Watch What the Health. It's what you just said is exactly the premise of What the Health.
Yeah, so it's really sad.
It's very sad. Please keep the conversation going. And what I love too is our viewers, a lot of them are international. So share your thoughts because you're living it, just like Grace shared her story. And we'll see you next time on Pop Sugar.